This presentation will help guide you for preparing for the midterm and final exam in advanced health assessment of adults. There are 2 exams in this course, and to prepare for them, I've created several group discussion forums. These discussion forums have questions asked in them that are either similar to or exactly like the midterm and final exam questions. The exam topics are evidence-based assessment, developmental adaptation of physical assessments, and social and cultural considerations and adaptation of the physical assessment. On the midterm, we're going to cover topics of health history interview techniques for people who are adults and elderly, and for those that have special needs. We're going to look at interpreting findings from skin, head, eye, ear, nose, and throat, and respiratory systems. We're going to identify and design health problem lists based on those findings, articulate the plan of care with communication. A special focus in this course is the SOAP note and the S-bar for verbal communication. Social determinants of health have to do with how the living environment, work environment, resource access, exposure to crime and violence, transportation and schools can influence the health trajectory of an individual. So these social determinants combined with people's genetic predispositions are what often determines health outcomes. In addition, we are studying genomics and the ethical implications that come alongside the knowledge of your genomic tendencies, and also the implications of health assessment reporting for things such as obtaining insurance. So these are the topics that are covered in the midterm. It's very important to successfully complete these exams that you correctly answer the question that is being asked. Previously, I've noticed students who answer a question, but it's not the question that's being asked. So please, if you have questions about the discussion forums, ask me about that. I will not be giving feedback in those discussion forums per se. That's a space for you and your peers to work on determining answers to these complex questions. I suggest you use an outline when you plan your answer and support your answer with citation of references. Many of the questions asked in these forums could have multiple correct answers. It all depends on what evidence you select to support that answer, and if that evidence is the strongest, most credible source. The final exam, which feels like a long time from now, is involved interpreting findings from the cardiac, gastrointestinal, musculoskeletal, neurologic, genitourinary, and endocrine systems. Those are the body systems that we cover in the second half of the course. And then we're looking again on best practices for working with people that have various differences in functioning. And we also look at assessment screening and assessment of risk for cardiovascular disease, cancer, and osteoporosis. You're going to integrate the knowledge of human genomics related to heart disease, stroke, diabetes, cancer, and Alzheimer's. And we will use those VoiceThread discussion forums related to evidence-based assessment, education, motivational interviewing, and advocacy will also benefit your preparation for the final exam. So know that the work you're doing across various assignments in this course all support and lead to your ability to answer the questions on these written exams. Thanks for joining me.